Hello, thank you for joining us on the Thursday edition of Journalist Hangout. I'm Ayodele Ozubaku. The race by humanity to stop the deadly coronavirus pandemic is still on. Join the fight by staying indoors and maintaining social distancing. Today on the program, Nigeria confirms 34 new COVID-19 cases in 5 states as total figure in the country rises to 407. I'll be hanging out with Babajide Kolade Otitoju and Solomon Ajutoku. So if you're ready, let the hangout start now. Many thanks for joining us. Now, the spike in the confirmed cases of the deadly COVID-19 pandemic in Nigeria is not something cheering to the ears, but the country has seen a rise in the figure. Now, the Nigeria Center for Disease Control, NCDC, announced 34 new cases of the coronavirus across 5 states in the country. The figure, the highest recorded cases in a day so far, brings a total number of confirmed cases of COVID-19 in Nigeria to 407. The country is still a long way from taming the deadly virus. But before we go into the discussion, let's share an awareness video by one of Nigeria's leading theater professionals, Dr. Tunji Shotimiri, with you.
Coronavirus, this is real. I mean, it's not a joke at all. We're dealing with a large family of zoonotic viruses that cause illness, from common cold to severe respiratory diseases. And some of these diseases can be life-threatening. So you can see that it's a matter of life and death. It's not a joke. So when we say zoonotic, we're talking about viruses that are able to be transmitted from animals to human beings. So those of us who have animals, we need to be very careful, all right? And there are several types of coronaviruses, but the one that is dealing with us, or the one that we're dealing with at the moment, is COVID-19. The bottom line is that these viruses are attacking us as human race. We need to deal with it, we need to expunge it, we need to exterminate it, we need to squash it, we need to crush it, we need to kill it before it kills us. This is an infection that can be transmitted from one person to other people through droplets. Droplets are small drops of liquid from our respiratory system. If you cough or you sneeze, so be careful. Create a space between yourself and people around you and you'll be fine. Right, wash your hands regularly, at least for 20 seconds. Sanitize your hands, all right, like that. If you have no business out there, stay indoors. I know you'll be asking me, if I stay indoors, what am I going to eat? Palliative measures will take care of all of that. Stay indoors and you will be fine.
Dr. Tunji Shotimiri from the Department of Theatre Arts, University of Lagos. Solomon, you remember?
Master.
Imagine, you remember what you did for us
yes.
the last time? Very talented man.
The master of mimicking people. And this is a particularly good one for him. We need to do whatever it requires of us to do to defeat this disease.
Yes.
And that is the message from him. And we truly appreciate that from
Jude, let me start today's program on a rather sad note. I called somebody from Ibadan this morning, and the lady actually told me that she's at work, and she's working, and everything is going on well in your state and everything. And I said, you guys are not afraid of the pandemic, you are not keeping indoors and everything. He said, there's actually no such thing. She's a graduate, a 30-year-old. She told me that there's actually no such thing. But have I not thought of it that is another way that government is using to fleece us? That they ask people in Abuja, Ogun State and Lagos to sit down at home because of they want to erect the 5G. By the time she finished, I didn't have any choice, but I had to just press the red button on my phone. That as of 2020, a graduate talking like this, he said, in Ibadan, everything is normal. And I say maybe it's because of the policy of Governor Makinde saying that he can't afford to shut down Ibadan and everything. But the way this thing is going, it will get to that time and it might be too late.
Graduates not believing that COVID is real is not new. A lot of our so-called graduates would amaze you if you get involved in an argument with them or a test for competence in speaking English language. You will see clearly that these guys are graduates, but they have no education in the real sense of the word. So I'm not, it no longer shocks me when so-called graduates behave badly or behave in a manner that questions their education. It no longer shocks me, but we must let our people know at this stage that this is real, very real, and our fears are growing daily. We can see clearly that even Kano that we thought was not going to be a problem, they now have about 20 cases.
The way the figure,
it keeps climbing. It keeps climbing. It's unfortunate, and I'm really scared for Kano because I worked in Kano for 7 years. I know the city very well. I know that a lockdown will not work in Kano in the true sense of the word. Because when we are talking about lockdown, it's looking like there's no lockdown anymore in our country. I do not understand a situation in which you say there's a lockdown and you give people room to go and buy stuff in the market. Maybe every other day they can go out.
yes.
And
one day on, one day off.
The roads
like
are
they practice in
roads,
states.
and even in Abuja, and the roads are clogged. People sitting in traffic for 3 hours during lockdown. So it's no longer a lockdown. That is a joke. Anybody who calls that a lockdown does not know what he's saying.
3 hours
Do
traffic.
they give people in Saudi Arabia, because when it comes to Nigeria, everything becomes inverted.
Upside down.
Do they give them room to go and shop in Dubai during lockdown? Haven't we seen area photographs
Deserted.
of Saudi Arabia right now? Everyone is in his house because they know that this is a disease that humanity is up against and humanity must defeat. But we continue to joke with it in our country, and the figures are climbing daily in a manner that truly worries me. Whether in Lagos or Edo or Kano, we are seeing signs. And the NCDC DG said the other day that every state will have its share.
The way the thing is going.
It's possible that he sees what the rest of us do not see.
Of course, they have projection.
He said every state will have its share.
Sure.
A state like Taraba, as we speak, they are still good.
The updates in Lagos, we have 232 in Lagos. FCT 58.
Ayo.
Osun 20. That's the figure, have you?
Forget those numbers. We have a situation in Lagos, which I know is also present in some other states. The time that it takes us to evacuate patients, people carrying the virus, is too long. Somebody told me that it takes 5 days in some cases to evacuate these people. And that at a point he had to tell a patient that he knew was carrying the thing, that drive straight to Onikon. You've waited enough. Drive straight to Onikon. What we have now is a situation in which, because people suspect that they are truly not well, and they are waiting at home, no one has come from NCDC to take them to those centers. They on their own now go into private clinics where they say, look, it's actually fever that I have, and then in the process, they infect other people. It happened in Kano. It happened in Ilorin. When those doctors refused to attend to the patient because they suspected that the person who brought the patient, that prof, was lying, what did the prof do? He picked up his phone and reported to the CMD. Your doctors are refusing to treat my patient, whereas my patient, this is the ailment that my patient is suffering from. What did we see? They were ordered to go and treat. That person ended up infecting the caregivers, innocent caregivers. We are putting the lives of doctors at risk because we refuse to do the right thing. So the response time has to be faster. We can't, it gives me the feeling that there are far more people there who are carrying this virus. But because the response time is slow, we are unable to quickly treat their cases.
By the day.
Yes.
That these figures might not actually.
No, they're not. No, they are not. If you can have 30 in one day, then that's an alarm bell.
Show you that
it's an alarm bell. 30 in a day is an alarm bell. All our neighbors, as I said yesterday, Cameroon and Niger, they are higher than us. Cameroon has in the region of 800 cases. And it shares border in Borno State, in Cross River and all with Nigeria. Niger Republic shares border with 6 Nigerian states in northern Nigeria. Niger Republic is on 570, as of 2 days ago, was on 570. So, and we all know our borders are porous. People will come in to trade and all that. How do we stop this thing from spreading in our country? It's a difficult task.
Solomon, this community spread, this phase is a very difficult phase. And the way I see the figure coming up from 3-something to 407, by this night, by the time it's 9 p.m., that the Center for Disease and Control, NCDC, will brief this night now, you hear the figure for tomorrow.
Well, they have to prove me wrong. You know, yesterday we had 30 in 24 hours. Today, yesterday to today, we have 34. So it's climbing. If you then check the curve, it's becoming a peak. You know, it's becoming sharp. You know, and I'm worried. I'm really, really worried. We talked about Kano yesterday, and I felt they were negligent in the first place. I'm still a bit shocked about Oyo State. I'm still a bit shocked. The lady should know that her governor caught that virus, except if he was lying to us. But it was before the whole world that the governor caught the virus. And if a governor who caught the virus could leave his state like that, knowing fully well the way the people there interact, the people in Oyo State interact, you know, So I wouldn't say I'm not amazed. I'm amazed that she said that, and I'm also surprised that the governor has been very slow to act. But besides that, I have been asking myself that if we say we have tested 5,000 to 9,000, how come, first and foremost, that we have this low number? Because if you have tested that number of people, then you should have been able to detect more people than we have at the moment. It's not like I'm a doomsday prophet, you know, because the more you test, the more you get. Because it's contradictory that you have tested 9,000 people, you have 407 cases, and then you're already raising alarm about community-to-community transmission. So there's a bit of contradiction there. Something is not just right. Either you are slow with the tests, you are slow with the evacuation, or you are missing your target with the tests. You see? So there are contradictions there. But there's something that occurred to me today. We probably would have been worse than this if President Muhammadu Buhari, this administration, had not initiated the border closure that we had long before this time. You know, I thought about it, that it didn't make sense, maybe only made sense economically, that we're closing down the border so that rice will not come in, so that this will not come in, so that people will not come in, and all of that. But you would have imagined the sort of egress we would have had, the sort of egress, you know, the point where people would have entered into this country long before now, carrying the virus, if this administration had not done that. I just thought about it, and I said, wow, we probably would have been in bigger danger. That does not, discountenance the fact that there's still a big problem on our hands. If the community transmission has already started, then we have a big problem. It means now that the caregivers, the NCDC people will have to start going from house to house, make inquiries, find out who is infected, who is not infected, and all of that. But to have tested 9,000 people and you have 407 cases, I think there is something wrong with that, except if you are testing the wrong people.
But actually, the next 14 days is going to be very, very vital, this fight. So, because a lot of people are saying that, okay, after these 14 days, what next? And I say, look, after the 14 days, it will decide so many things. Because the way we are going, this 407, and but we're discharging people, they're treating people, but in commensurate to the number of people that...
Well, more people more confirmed cases are happening. So, naturally, we are discharging people, yes, because we are also doing well in treating them. That's one area where you have to commend the Lagos people. They are treating them, and after treatment, they are doing tests for them, and they are returning the negative results. It means that they are doing well in that area. But the number of people who are infected is rising. Until we start seeing a sharp decline in the number of fresh cases, honestly, we cannot sleep with our two eyes closed. We would remain worried that this virus will remain worried because, frankly, the more cases we have, the greater the burden for the NCDC and all of the people involved in this war. So I still think that our governors are not doing enough. There should have been a form of congruity in the battle. You can't have a situation in which, in a geopolitical zone, only one state is doing a lockdown. A state implements a lockdown. Other states, 5 other states in the zone, refuse to. Look at Anambra. Anambra did lockdown. Other states of the southeast refused. So how do you then defeat the virus? And you know that all of these states are linked. They are linked together. So that's the way. At the point when Kaduna decided to do the curfew, Kaduna was the first state in Nigeria to come up with this idea. In complete in line with the true character of the governor of that state. You know, he's never afraid to take the big decisions. He's a man for the big decisions. So El-Rufai decided quickly, let's have this curfew. Because he warned, when he reeled out the measures that he was going to take, well, I'm going to close down markets, this and that. If you are not selling food and medicines, stay away from the markets. I'm going to close the markets, I'm going to fumigate them. He showed leadership amongst governors by taking that early step. And then he warned that if you do not comply, I will be forced to make this lockdown total. And he did that. At that point, Kano should have taken a similar decision. Kano is just maximum 2.5 hours away from Kaduna. In those days, on that Kano-Kaduna highway, some people would do even 1 hour, 1 hour, 40 minutes, because the road was very good. So the two states are too close to one another to not have a situation in which the two governors apply these measures the same time, the same way.
Okay, I have my first caller is calling us from Malaga, Spain. Thank you for joining us, Edward. Hello, Edward. Hello? Edward, are you here? All right, because I would have loved him to give us a kind of updates on what's happening in
Hopefully
Spain.
we'll be able to cover.
Spain is one of the hot
One of
countries.
the high-burden states and countries. So this is the thing. I'm disappointed that governors, they have meetings among them, northern governors, governors of the South, they appointed leaders amongst themselves. Yet they can't come together to say, let us do this for the sake of our people. And our people still do not understand the dangers involved in this. I saw a picture of some people in Nasarawa State who ran into the bush to do Jumat prayers because they felt if they did not go into the bush, they could be stopped.
Oh,
They
left the mosque
They went into the bush.
to go and do Juma.
Yes, they gathered in the bush to do it. And I said, if Saudi Arabia could go to the length that they went, you know, in Kusada, in Katsina State, they even set ablaze a police station because they were stopped from having Jumat prayers. If Saudi Arabia, the home of Islam, in inverted commas, could ban public prayers, if Iran could ban public areas, public prayers, congregational prayers, what is the matter with us in our country? Because these are the things making it difficult for us to truly defeat this virus.
We are more Catholic than the Pope.
Well, I don't think it's a problem of religion. I think it's a problem of the value system, and we keep saying this. It's a problem of the value system. It's not a problem of religion. Religion in itself is not harmful because it's an artifact of society. There is no society. It's an artifact of culture. Culture is what cements societies. So religion is just one strand of it, and it's a very key one at that. But then, having said that, I'm just... I don't know how to, but I have lost the words to describe exactly how I feel, because now I have seen 30, I have seen 34. I projected days before that we were going to have a rise. Now I do not know to what extent this rise is going to lead us. Okay, and I have always asked myself, okay, if in 1918 we had 50 million deaths all over the world, and Nigeria had such a huge chunk, the area called Nigeria had such a huge chunk of about 500,000 people who lost their lives. I'm worried now that, okay, we're a bit more sophisticated than we were in 1918, 1920. The world is much more sophisticated. Is the virus much more sophisticated now than it was in 1918, 1920? Or have we acquired a bit of know-how to be able to stop this so that we do not lose as much as 50 million people again?
We can't lose that number.
And Nigeria,
that's what? It's not possible.
You know, but I'm a bit worried that over the years, there's been so much negligence. And this is a situation where our weak health systems now have to really, really, really fight. And unfortunately, some people are still behaving like Mr. Thomas in the Bible, who doubted everything.
Nicodemus.
You know, who doubted everything. So, but I will come to the point of sensitization. I think we still need to rack up sensitization. The question I ask when people say social media, conventional media, and the question I ask is how many households have TV? If the large population of Nigerians, the largest group of Nigerians do not live in the urban centers where you have some good roads, where you have some water. The majority of the people live in rural areas, and you must understand the characteristics of these rural areas. You need to create communication systems that will cater to the sensitization needs of these people so that they will be aware. If we keep drumming, okay, we do this every day, every other day, Monday to Friday, then the news reports Sunday to Monday, consistently, every hour. We need to do more at the grassroots level, whether with the traditional rulers, whether with the traditional town criers, whether with the enlightenment trucks and buses of the
Just get the
local
message out
government.
there.
We need to keep doing this every day. We need to keep announcing. We need to keep going around the streets so that once the thing continues to ring and ring and ring, you know, when people watch TV like this, there's a tendency, it's fleeting. People tend to forget. People tend to forget. But when you meet them in their space, in their territory, where they are, with the traditional means, with face-to-face communication, you can actually, I think it's the communication that is key now.
Julie, let's talk palliative now. Yesterday we started a crusade, and I got a lot of calls, people calling me to say like the way to go, and I'm sure Nigerians will start coming up. Now, the national leader of the All Progressive Congress, Asiwaju Bola Ahmed Tinubu, has urged the federal government to pay a kind of relief fund to Nigerians over the COVID-19. And I can confirm it that in the United States of America, on Monday, they start getting their check. They got their check, some $1,200, some $1,500, depending on how large family and everything. But at least somebody, my friend Suleiman Alede, confirmed it to me yesterday that at least the wife there actually got her own check. So now, Asiwaju is saying the federal government should pay relief funds. How feasible is this?
No, it is possible. It is possible. It's not saying that the government should empty the treasury and pay. What he's suggesting is, look, the people need to be supported. And he's saying that through their BVN, we should be able to pay people some money. And he's also of the view that doing that will also bring more people into the formal banking sector because there are many people out there who refuse to use the bank. I remember when I was in Kano, some multimillionaires, traders, they don't use the bank. They have huge safes, Kantenkwori. They have huge safes, they put their money there, they trade with their money. You know, they don't, you talk to them about bank, they say, no, it's not necessary. That's why because they don't need any form of interest on their money. You know, that's why the Jaiz Bank idea came, so that for those who religion, who for the purpose of their religion, they don't want any form of interest capitalization on their money. Then that's the alternative.
I think it's even against the tenet of
yes. Islam. So they will say, no, I don't need you to increase my money, this and that. So Asiwaju is saying, look, if we do that, more people will come into the formal banking sector. And he's saying that, look, government can also support companies by helping companies to offset their salaries of workers and all that. That will keep those companies going, and that will ensure that those workers get paid. Because the truth is, this is a terrible time for companies, for individuals who are working. A lot of them will lose their jobs. And private sectors. Whether we like it or not, many people will lose their jobs. Look at the airlines, for example. They've not been able to fly. You know, so this is saying, look, for people using the BVN, you can pay some amount of money into their accounts. And then they will be able to solve problems with it. Look at what he said. Most families need relief. If relief is not forthcoming, these families risk hunger and its attendant sufferings and woes. So, because we have discovered the actual victims of this crisis, now what do we do to mitigate the pains that people are going through? That's what the national leader of the APC is saying. Let's pay some money into people's accounts. Let's activate the trader money initiative. Because even now, they need people, they really need that money so that they can buy some things, they can buy food for their family, they can take care of their children and all that. If we do not do that, the crisis that is on the way, we will not be able to handle it because tension is rising now. And if these figures continue to climb, it will be necessary to extend. That is, it's not what Nigerians want to imagine.
Want to hear.
But if it continues to climb, There's no responsible government that will say, oh, in spite of the fact that it's climbing, we are relaxing the measures. Even the WHO is saying no.
Advised against
It's
it, that no
advising against
country.
it. That if you lift this, you will reverse the gains that you have made
to be eroded
in the last few
come
months.
in triple fold.
So that is the thing.
Okay, we'll take this breather to pay some bills. When we come back, we'll talk more. Stay with us. Award-winning program reaching you live from Television Continental here in our headquarters in Lagos, Nigeria. And this is Journalist Hangouts. Babajide, COVID-19. Oh, Solomon, let me come to you now. It took a break. Already, when you see our budget projection for 2020, Nigeria was already in trouble to actualize that budget. Then the oil prices came, those dived before COVID-19 came. Now, after COVID-19, I'm afraid for Nigeria economy almost in comatose before, then after COVID-19, a lot of harm would have been done to this nation's economy and countries across the world.
First, I do not want to worry about the economy first. Let's face it.
Life first.
Life first.
Survival.
This is important. People need to survive. It's not the first time the world has been in this sort of turmoil. It is those who survived that built what we have experienced today. If you have life, you can always build. It's after crisis like this, or it is in time of crisis like this, that great leaders emerge who help to build a new world, a new life, a new culture, a new structure. So I know that there will be the problem of the economy after all of this. But I do not want to worry about it now, because first I need to survive. People need to survive. It is those who live after this pandemic then that will face the reality of their new world after that. So I do not want to talk about that, because in the first place, if you say, okay, what's going to happen to the Nigerian nation? But people have to be in there first, because if it gets worse than this, there is very little you can do. There's very little you can do. People need to eat. If people don't get to eat, in the end, if we have to extend and extend, as Jide said, once the figures continue to climb, we will have to extend. It is a reality that we need to face.
So Nigeria should brace up.
Yes.
There's not going to be, you can't do propaganda with it.
From the doctors and other stakeholders. So if the stakeholders advise an extension, what do you then do as a leader?
Wow.
If it's inevitable, as a leader, you must be ready to take the big decisions. You know? But in all of that, you also have to find a way to ease the pain. That will be the challenge for the government. You must find a way to ease the pain. If it becomes inevitable for us to save ourselves, save our lives, a government that is a truly serious one will take the big decisions, no matter how painful those big decisions are. But you will have to be convinced at the end of the day that you took that decision for an overriding interest, a public interest. Trump is describing himself now as a wartime president. Whether we like it or not, we are at war. We are at war with a virus that is bent on exterminating the human race.
The threats to him.
It's a big threat. Big threat. Nobody knows when this will end. Even the Chinese, who are gloating that they've survived it, they're already having fresh cases. Fresh
cases, 178, 120.
So this is, we don't know when this will end, but we must be prepared to defeat it. A new virus that we are not used to happens on our space. We have to brace up. Whatever it costs, whatever sacrifice that we need to take, we must be ready to make that sacrifice so that at the end of the day, we survive it and we'll be able to tell the story that, yes, COVID-19, we survived you.
This is the time really to summon the best capacity of Nigeria and the Nigerian people. This is not the time to play politics. This is not the time for quota system. This is not the time for Well, some things will actually have to be suspended, like your federal character. This is the time to summon the best of the best in this country. This is the time to start something completely new. Wherever you can get them, wherever they are in this country, who have the best brains to help build, we're already in trouble. We're already in trouble.
Right.
Because first, before coronavirus came, we're already grappling with the problem of the economy. Now we're in trouble. The coronavirus has, turned everything on its head. So what we have to do now is to summon the best capacity of Nigeria, the best capacity of Nigerians, the best experts in all of this.
The best resilience.
We have to summon everything, or else we'll be in bigger trouble. It's already a big trouble.
Palliatives again.
Yes, as I said yesterday, this is the time for our rich people and our politicians to help the needy. Some of them are not doing it, some have begun to do it. In Borno State, all the 28 House of Assembly members agreed to forfeit their 2 months' salary.
2 months?
Yes, 2 months' salary, March and April.
Borno?
Yes, under the leadership of their speaker, Abdul Karim. They've considered their 2 months' salaries and handed over to the head of the task force, which is the deputy governor of the state.
That's a high level of commitment.
Yes, a long time ago they took that decision. Now, what the deputy governor and co need to do is buy what the people need. Buy what the people need, rice, beans. The people need food at this time. People are hungry. That is a fact. So buy what they need. Wole Oke, the federal lawmaker from Osun State, donated rice valued at 15 million. PDP lawmaker, 15 million. The APC senators in the state, lawmakers in the state, said, okay, we are contributing 5 million. I think they need to do more. I thank them for
together.
what? Yes.
3 senators.
The lawmakers were put together, APC. Yes.
You said the senators.
No, not so.
Okay.
Lawmakers. Even
Okay.
the other man. Now the federal lawmakers came together to donate
both upper and lower house 5 million.
Now we are saying you need to do more. Even in Borno, we have not seen what the senators have done. If these guys have considered what the senators, Aliun Dume and the other senators, Senator Kyari, all of them in Borno, what they need to do is come out, buy rice that can be distributed. It is food. Don't give people money. Not, if we give people money, it will be embezzled. Because I heard that a big senator from Lagos brought money, big money. No, it's not money at this time. Buy the relief materials. Get people to buy the relief materials and distribute this relief material. You can imagine if you go to a place like Agege that is hot at this time, where tension is high, and those people who are hungry, you just unleash a few trailer loads of rice. Let them at least have something that they can chew on for days, so that you ease the burden on them during this period. That is what we need to do. Food, our people need food at this time, and I'm calling on the rich people. We have talked about Faleke. Faleke showed the example. Remy, the commissioner for works in Osun, he showed the example, and many people are encouraged. They are even donating rice to him now that, oh, you did this, we will support you. That's what we want.
People are calling Omawari now.
That's what we want. The Yishao, Bolan Yishao too. He went to the army barracks and distributed relief materials. We want to see more of his colleagues in that Lagos House of Assembly.
There are 40 in number.
Yes, there are 40. And they pride themselves as the best House of Assembly in Nigeria. I don't know if they still retain that title. They need to go out and their constituencies
Especially
distribute food to people.
You've
got the money to do it.
Like Lagos.
Yes.
So
if people don't come out to support Sanwo-Olu in this matter, we'll be in trouble. There's no way the government alone can do it. What are all the lawmakers doing? What are other public servants who have means? What are they doing?
27 House of Rep members, I think, from Lagos, so 27 or 24.
If all of them If all of them will be selfless, if all of them will be selfless, and they pick their constituencies and they do what this young man is doing, 4,000, he got 4,000 packs, food packs, to distribute to people. If all of those federal lawmakers from Lagos State, all of the senators from Lagos State would do that, this thing will go round and a lot of people will be happier. That is what we want to see.
So your constituents, they will get in touch with us, they will call us, they will tell us.
Yes. Those of them who are not doing anything, who are refusing to do anything.
They are calling you out now.
During the elections, you need them.
During the election,
you come to them, you take their votes.
You'll
be sharing money to them.
And those ones will sell their future.
I think that one key thing that the national leader of the APC
this is somebody in the rain. So I mean, in the rain.
One of the key things that the national leader of the APC has raised is a mechanism, a system. People need this, and we have to evolve a system. What does the state exist for? It's for the people. If you do not have people, then you can't have the state. You can't have the state. So we need to evolve a mechanism. Yes, we've talked about food pass, we've talked about people contributing money. We need to create a foolproof system where people get this thing directly. People feel the impact.
That's why I'm saying don't give money.
Exactly.
Don't give money.
So we don't have to get missive. You know, sometimes people can go to a place and start distributing, and then you actually missive, and then you distribute to people, you distribute to the same people over and over and over and over again, and then you neglect some people. So we need to come out with a foolproof system where this thing gets to the people who need them, not those who do not need them, because there are lots of people who do not need the palliatives, who are also going to get the palliatives, and then in the end they are complaining. Because if you need something, actually, if you need food and you get food, and then you are complaining about the food when there is really nothing wrong with the food, then it actually means that you don't need it.
Like that's why they said the vulnerable people.
Yes. Tribune Online yesterday ran a story and that the Minister of this humanitarian affairs said that she was quoted to have said anybody with 5,000 naira in the accounts,
more than 5,000.
More than 5,000 will not benefit from
that. Means
that
person is not poor.
That means that person is not poor.
Really?
According to Tribune Online, that that person.
But what Asiwaju is even suggesting is that the money should be paid to for households.
Okay.
Which means that my dad, for example, he has 5 children.
Okay.
So when they send to him,
it is
imagine all of us get something.
That
is, but it does not, and he admitted it. The leader himself admitted that it does not favor people with large, because at the end of the day, it's a uniform amount of money that you want to send out. So if your household is large, you stand at a form of disadvantage. But it has to be done, and it has to be uniform, so that people will not say, oh, this is the way this thing is being done. The food that I shared at Fashakin, yesterday, people came from distant places. A pregnant woman came all the way from Agbado. Yes, and she was already panting. I said, just bring that bag of rice, just give her, let her go. Some people trek, if you know Akute very well, some people came all the way from Pipeline. People came from different places. They got information that, oh, they were sharing food somewhere in Fashakin, and our people came. Oninyoni, distant places. So if you know those places very well, you'll be amazed. From Iboko, distant places, they came just to make sure that they got something from Captain Jamil.
There is this story of a woman who trekked all the way from Iyanokpaja. She was going to Maryland. And why was she going to Maryland? She was broke, she had nothing. She had been collecting Gary from her neighbor. But she got tired of begging the neighbor for Gary, because even the neighbor too was struggling. So she decided that she was going to see her sister in Maryland, and she trekked with her daughter. Then a policeman riding on the way saw her and asked her where she was going. And she said she told the man she was going to Maryland. Well, what are you going to Maryland to do? And explained to the policeman. It was this policeman who had to go to the ATM, withdrew money, and gave to her, and dropped her at Maryland. So people really have need.
People are going through a lot in our country.
You know, I just said this story so that
yes,
a policeman,
a
policeman.
No, there are good policemen around. Just as we have bad eggs too among them, there are good ones.
You know, had pity on this woman. She just has a daughter. They had to trek all the way. They were going to.
Somebody collapsed at Abuleba bus stop, and they were finding the man, and somebody was just intelligent enough to get a plate of rice and meat. The man pounced on it and was eating. I said he has not eaten in the last 48 hours. And people were bringing money. I said he has been walking, trekking, just to look for something to eat that he cannot afford to steal.
Yes.
So they gave him a plate of rice.
People would rather not steal, but they are going through a lot. I'm telling you, some of the people that I was sharing rice to, they will go change their headgear, queue up again.
To have another portion.
Yes.
That's great, though.
It's great. It's great. It's great. But you don't know how many mouths they want to feed.
The uncertainty of when
some of them are trying to provide a form of guarantee security that can last. The kind of food security that can last many days.
What you don't need.
You know, the thing. No,
generation
no. See,
the money.
if you are sharing 5 kilogram a bag of rice. This person knows that if she gets 10 kilograms, I'm by no means not encouraging that, but I saw
the next 14 days.
You know, at least that will last. You don't know how many children she has. You're giving that 5 kg because you want it to go around as much as possible. But this person probably has more kids than most women on the queue. So they will go and change their headgear and then line up. So if you are not attentive enough, very observant, you will not know that it's the same person that you gave a pack of rice the other time. Some will go and change their dress entirely. I'll still queue. They know we don't live with them, so we don't know them by face. But at the end of the day, at least more people will be happy to be there distributing food packs to more than 270 people at once is something that gives me joy, and I want to encourage Nigerians to continue to do. We can help the government ease the pain on our people. We can. That's why those lawmakers, we are begging them. I hear that the chairman of Ifakojaye is doing a fantastic job. He needs to do more. Whatever he's doing now, he needs to do more. We just have to encourage them. Bola Oyishao, talk to your colleagues. We want to see what they are doing in the State House of Assembly. We want to see what your speaker is doing. I learned that the speaker distributed bread, and some boys were kind of poking fun. Somebody felt like feeding you, helping you, and you are playing ball with the bread that he gave you. I mean, it's senseless. It's a sense of that is why I agree with Solomon that some of the people who eventually get this and don't need it. For some of those boys, maybe what they need the most is a wrap of Indian hemp. But those women, those very old women, there's no way you give them Obasa's bread and they will say, no, that this is not good enough. You know? So this is the thing. We have to identify the people who need these things the most and reach out to them.
Talking about saving culture, talking about the level of stability when this COVID thing came, it caught a lot of Nigerians, especially Lagosians and
I told somebody, I said, save for the rainy day, save for the rainy day. When we were in primary school, we were taught moral instruction. Save for the rainy day, save for the rainy day. The rainy day has come. A lot of people didn't save for the rainy day.
But they will tell you that economy it's difficult to save, that they live from hand to mouth.
If you
That's
know
for those who live from
how
hand to mouth.
prices of food items have gone up.
Yeah, deliberately.
See,
this is not government now.
Make nonsense of whatever savings that you made.
But if it is the savings you have made that you still live on, if you have any anyway.
We make things difficult for ourselves.
It is the savings, even in this time when prices have gone up because of this problem, prices will go up naturally. Except you have a mechanism, a strategy of enforcing price control. You know, but these things will go up naturally. But then it is the savings you have at this moment. Now you cannot try to buy land except you have excess money. Now you cannot buy washing machine,
machine
or iron.
Talking about survivor.
That's the point.
You can't even
You
see that
can.
chest.
So
Maybe
the only
that's
thing you should be
true.
thinking about now is feeding. You know, an incident happened on my street yesterday. A young lady who had just gone to rent an apartment when she should be at this time. In fact, it was the women on the street that were discussing when the lady drove off and was saying she was going to Omole. I said, you alone in an apartment. You are moving to an apartment when you should be with your siblings, your family, at this critical time. If anything happens to you in one room or in your mini flat, you're on your own.
Babajide, South Korea Centers for Disease Control and Prevention sees 141 people who recovered from the COVID-19 have tested positive again. That means even we are discharging people, they are leaving the hospital. That means the prospect of still infected still there.
They are not that's not the first place where it happened. So it's a dangerous virus that we are contending against. It just requires vigilance from us. See, vigilance. You can easily, we just have to, as people have suggested, that this issue of social distancing, we should keep it in place up till around September, when hopefully some of the vaccines will be out. The Americans project that their vaccine that Johnson & Johnson are working on will be out by September. We just have to continue to maintain this personal hygiene, washing of hands, using of sanitizer and all that. Even if you are well now, maintain social distancing. Those measures, keep them in place, because there is it's not a vaccine that you have taken. The vaccine will give you a kind of protection against it forever. But you have no vaccine. So that means you can easily contract it again.
Professor
People need discipline, extensive discipline. Even in the office place, the people are not showing discipline.
Okay, and the maestro himself, Babajide Kolade Otitoju, will do this again. And that's what we have for you on Journalist Hangout today. Join us tomorrow for another episode of the program. You can watch Journalist Hangout on our platforms showing on the screen. We're on YouTube, youtube.com/TVC News Nigeria. Our feedback channel is Journalist Hangout at tvcnews.tv. I am Ayodele Uzubaku, urging you to stay at home and stay safe.